Hi, my name is Michael Roxon, and I'm here to talk about the measles. Let's begin. Measles is a dangerous virus that still affects over 200,000 people a year and causes 150,000 deaths or more a year. Now, even though 85% of the world is vaccinated, measles coverage is still the worst in sub-Saharan Africa, the South Asian islands, and a few countries spread across the Middle East. Now, in the 85% of the world that is vaccinated, 65% of those countries have well over 90% coverage. Compare that to the 50% coverage in the areas I just listed. Now, in those regions, there are many dangers involved in the measles virus, including high fever, coughing, and sneezing, which can lead to swollen tongue with white spots due to the amount of white blood cells that clump up during the swelling. A rash can develop all over the body, mainly in the head, the arms, the trunk, and even down in the legs. Bacterial infections can also come as a part of the fever. Raised blood spots can start to appear on the rash after a couple days. Bronchitis and laryngitis can also develop, which are inflammations in the air tubes that go down into the lungs and the upper throat. Pneumonia, an infection in the upper chest cavity, can also develop. Thrombocytopenia, or reduction in platelets, red blood cell fragments that help stop bleeding when you get cut, can also occur. Birth complications such as miscarriage, premature death, and low birth weight are also a result of a measles virus if it attacks a pregnant woman. And lastly, most importantly, the measles virus can actually lead to encephalitis, or the inflammation of the brain, which can lead to coma and even death. Now, in the United States, we have well over 90% coverage of the measles through vaccines. We've had well over 80% coverage in this country since the mid-1970s. The last endemic case of the measles in the United States was in 2000. Now, endemic means regularly, naturally occurring cases of the disease. Now, if we don't have any, it means that it doesn't regularly occur. Now, you might be wondering, how do we have an outbreak? We had the outbreak earlier this year. It's because we don't have total vaccination in this country, we don't have total vaccination in the world, and that's how it spreads. Now, this brings me to all the different factors that go into getting the measles. First and foremost, if you don't have a vaccine, or if you're immune compromised, that is how you get the disease. And the most immune compromised are young children and pregnant women. And this is what the disease attacks the most. It's what the disease causes the most deaths through. Now, if you do lots of international travel, work with lots of people, especially lots of sick people, or you're around lots of people in general, that it also puts you at a much higher risk of developing the disease. So this comes with going to any school, any educational institution, or working in hospitals, or being in the healthcare professional in general. This will put you at a much higher risk of getting the disease. Now, the disease spreads through mucus and saliva. So you don't just have to be next to someone and breathe in what they cough or sneeze. You can also get the disease by contacting a surface that has the residue of someone's mucus or saliva on it. Now, the United States went on a campaign to vaccinate and eliminate the disease in the country, and as a result, we no longer have an endemic rate of measles. However, without total vaccination in the country and throughout the world, we have outbreaks such as the one we saw earlier this year, where we had 668 total cases in the United States, 20 in the state of Florida. Compare this to the 200,000 cases every single year. It's nothing. Now, most cases of reported measles come from sub-Saharan Africa, countries throughout North and West Africa, South America, and the Middle East, and Asia, where there are countries that have 100 regular endemic cases a year, leading all the way up to over 1,000 endemic cases every single year. Now, this clearly reflects the fact that developing countries need the resources to eliminate a disease that we eliminated in the Americas a couple years ago, and relatively easily. There's a huge correlation between high vaccination and low infection rates and low death rates due to the disease. So I did some research on the CDC website, and I noticed that it's $20 for 10 vaccine doses of the MMR, or measles, mumps, rubella vaccine. These three diseases come together as part of one vaccine because of how closely related they are. Now, I noticed it's $2 a vaccine. We can mass produce that 1, 2, 3. We could eliminate this disease 1, 2, 3. We could eliminate a disease that kills 150,000 people a year, mostly young children and pregnant women. It affects over 200,000 people every single year. And we could eliminate that 1, 2, 3. How do I propose we do that? 1, we develop a vaccine that can be refrigerated and transported easily. 2, if we found a way to mass produce it cheaply. And 3, we went on a mass vaccination campaign in those areas that still need it. We could do something incredible. We could turn MMR into the next smallpox, the next big step for public health. We could eliminate MMR within the next 10 years. Thank you very much.